Hey, hello beautiful people, welcome back to my video again. I'm Sir Rashid, and today in this video I'll be trying to clear some of the misconceptions about a world's most commonly emerging lethal disease, that's the cancer. Most of the people throughout the world are having a misconception about this cancer. Let me start with the definition of the cancer. Cancer simply means it's an uncontrolled division of the cells in our body. So as a result, there occurs formation of an abnormal mass of a tissue, and sometimes this mass or these cells can metastasize or spread to the other parts of the body, and sometimes they remain to a confined tissue. So let's not go much deep into the cancer per se, but I just want to clear some of the misconceptions about this cancer. Starting from the first misconception among the people is that people consider this cancer as it's an untreatable disease. That means if someone gets this cancer, their death is imminent. That means that most of the people, even some qualified personalities, is having this conception that oh my god, if someone gets this cancer, they're going to die definitely 100%, they cannot live anymore, there is no permanent cure or treatment for this cancer. However, this is practically not true. Let me tell you that most of the cancers are treatable. We have a definitive treatment for the cancers, but the condition is that if this cancer should be detected and diagnosed at early stage. If we see, cancer has almost 4 stages. The stage 1 and stage 2. In this stage, if the cancer is detected and diagnosed, almost 100% of the people will get fine, okay, cured and treated. And if this cancer gets detected and diagnosed in the 3rd stage of the cancer, most of the people will be treated, of course, and but sometimes we may need to put them on the multiple therapies. And then comes the 4th stage of the cancer, which is almost to the late stage or last stage of the cancer. Even in this stage of cancer, our first aim is to control the metastasis of the cancer, or that's the spread of the cancer. And even if it is spread and it's untreatable, our aim is to give these patients a palliative therapy. That means we try to reduce their pain. So to these patients who are at the last stage or 4th stage of the cancer, first of all, we try some therapies, like we have the chemotherapy, we have the radiotherapy, even we can go for the aggressive resection by surgery, or even we have the medical management also. But of course they are at the late stage of the cancer, because most of these cancers have spread to the peripheral organs, and if it becomes hard to control this spread, our aim is to give these patients the palliative therapy, in which we try to control their symptoms or treat their symptoms. Our aim is to relieve their pain and give them other supports, and so that we can definitely ease their pain. So this is one of the common misconception among the people, that they feel this is a deadly disease. Of course this is deadly disease, but it's not true that it cannot be cured or treated. We have most of the cancers we can treat 100%. So the second misconception among the people about this cancer is that once this cancer is diagnosed and doctor wants to confirm the diagnosis, whether which type of cancer is this, what should be our treatment protocol, etc. So for that they try to give the patient advice for going for some basic investigations like biopsies or fine needle aspirations, so to confirm the diagnosis. But people are scared of doing these investigations, because they have this misconception that if there comes any metallic tool near these cancer cells, or there is any incision to any organ, they have the chances of or risk of spreading this cancer more and even getting worse. So this is also a misconception. It is not true. There is no risk of spread or getting worse by doing the biopsies or FNACs. Perhaps it will help the doctor to diagnose the particular type of cancer and early management of the cancer, and that's a pulse point, and that's going to help you, of course. Now, one more misconception among the people is that once this cancer is now confirmed and diagnosed, which type of cancer is this, now doctor wants to go for whether it is a medical therapy, or it's a chemotherapy or radiotherapy, or even surgical recession, whatever it is. Most of the people have this misconception that if they go for the chemo, they will definitely lose their hairs and they will have the hair fall and other potential side effects. I must tell you that of course you are true about these facts, that these therapies are having the side effects, most commonly the alopecia or the hair fall. But let me tell you one thing, that more important and vital than your hairs is your, of course, life. And yeah, this hair fall is of course a temporary side effect. Once you stop the chemo, you will definitely regain your hair 100%. So don't go and run about these misconceptions. Keep these out of your mind. If you or any one of your dear one is getting diagnosed with the cancer and they have this fear and misconception of getting hair fall and other side effects by these chemo or other therapies, just tell them that it's temporary. It's going to be reversible again in the upcoming time once you stop these therapies. So go for it. So guys, these are few of the misconceptions among the people. Most of the minds is having these misconceptions, and I just want to tell you that the prognosis or outcomes of the cancer depends on the stage at which it is detected and diagnosed. So early it is detected and diagnosed, better are the prognosis, better are the chances of getting fine, and the treatment is effective even in the early stages of cancer. So there are some basic symptoms or cardinal symptoms, I may say, that about the cancer if someone may suspect that they are having cancer. But let me warn you that these signs, what I am telling you here, are not confirmed to the cancer. They can be the cause of other diseases also. But yes, if you're having any of these symptoms, what I'm going to tell you, you must go to screen yourself at a medical health center. So these symptoms are like, if you are having any kind of secretion or bloody discharge from your any opening of your body. For example, you are having any discharge from your nose or from your mouth, any bloody discharge from your mouth, even with this mixed with the saliva, or even from your ears, or even your it's with your urine or stools, any bloody discharge or mucus secretion from these parts, you should definitely go for a medical health center to screen yourself. And I will suggest to the most of the females, like who having any kind of family history or first degree relative history of any breast cancer, they should definitely go for screening. If there is age about 35 years or even 40 years of age, they should start screening themselves by having the mammography. So these all will help you to detect and diagnose this cancer at an early stage, so that whether if someone gets it, there could be a possible good outcome and they could be treated on a perfect time. And hope all of your misconceptions got cleared right now. And if you're having further misconceptions or any question about the cancer, please let me know in the comment section. I would love to give answers to your all the queries and questions. So I will meet you in the next video with some more information. Until that, take care and Allah Hafiz.